नमस्कार दोस्तों, मैं डॉक्टर नीलेश चोरडिया। मैं स्पेशलिटी सर्जिकल ऑन्कोलॉजी घाटकोपर और ठाणे ब्रांच में एज अ गायनी ऑन्को सर्जन काम करता हूँ। तो इसमें काफ़ी सारे लोगों के मन में कुछ डाउट्स है, उन्होंने पूछे। आज मैं उसकी जवाब देने की आपको कोशिश करूँगा। So basically a 56-year female, and she had a positive family history of ovarian cancer, and now her symptoms are again dull pain in abdomen, gas trouble. It again goes towards ovarian tumor. So I would like to examine patient first to identify whether she has ascites, any lump palpable, any breathlessness, any supraclavicular lymph node palpable or not. So that will be my first clinical impression to what are the things. And second thing, in that scenario, I will like, since family history was positive, I will like to do at least a scan of abdomen. You can do in the beginning sonography, but ideally better to do CT scan. So basically she has bilateral ovarian masses, she has ascites, she has peritoneal deposits also, and she has omental deposit also. So basically this looks like a stage 3 ovarian cancer, stage 3C I can say. So basically stage 4 is if disease is present in the liver or lung. Apart from that, if it is spread to the abdominal cavity, it becomes stage 3. Here I would like to do CT scan of the chest also or a PET scan to identify whether thoracic cavity, lung cavity, chest cavity is involved or not. If it is involved, we will proceed with chemotherapy first, but we have to confirm the diagnosis prior to starting any treatment. So we generally do ascitic fluid tapping. We send it for cytology for malignant cells. If cytology is showing cancer, we can proceed with further treatment. If cytology is not showing cancer after 2 or more attempts, then we prefer to do a staging laparoscopy where we examine the abdominal cavity by endoscope, and at the same time we take biopsy also from the representative sample to confirm the diagnosis. So here we have two advantages. We can assess, first we get diagnosis confirmation, and second thing we get access to the peritoneal cavity to identify whether we can remove the disease completely or not. Because ovarian cancer, the complete cure depends upon are you able to remove the tumor 100% or not. 100% I am talking a gross tumor, not microscopic tumor. So if you can remove 100% tumor which is visible, surgery is first choice. Why? There are some people who have done chemotherapy first, followed by surgery, followed by more chemotherapy. Means it's called sandwich therapy. So in sandwich therapy, generally tumor gets chemo drugs, and some tumor cells, they try to be over smart and they try to become resistant for the chemo drugs. So it causes problem in the future. So if you are able to remove tumor at first setting, it is always better rather than giving chance for tumor to become chemo resistant and then give trouble later on. So if 100% removal possible, I will always prefer a primary cytoreduction surgery where we remove the entire tumor burden. We remove the uterus, ovaries, omentum, peritoneal lining, inner lining. It's called peritoneectomy. So everything from the diaphragm, the pleural cavity, the diaphragm till the lower pelvis area, covering uterus, urinary bladder, rectum, all the peritoneal covering is removed. So we can remove 100% of grossly visible tumor, and it definitely gives a good success rate. And if my staging laparoscopy is showing extensive disease, or if patient's general condition is very weak because this surgery is little extensive, the patient should be able to tolerate that thing. So if I feel that patient is little cachectic or she will not be able to tolerate upfront, then rather than putting her at risk for surgery complications, better to then give some chemotherapy drug first. Here we give 3 cycles chemotherapy drugs and then we operate. But our surgery remains same. We remove the entire peritoneum, irrespective it is involved or not, as we don't want to keep these chemo-resistant cells in the abdomen, which gives good results. And nowadays, the chemotherapy is combined in interval setting with hyperthermic intraperitoneal chemotherapy. So even the microscopic disease which was present inside, were directly giving chemo drugs at high temperature in the abdominal cavity. So in this, the recurrence rate decreases drastically, and it helps in cure of the patient.